10,000 federal workers, health workers, are to be laid off. The Trump administration announced on Thursday that it was laying off 10,000 employees at the Health and Human Services Department as part of a broad reorganization that reflects the priorities of the Health Secretary Robert F. Kennedy Jr. and the White House's drive to shrink the government. The layoffs are a drastic reduction in personnel for the Health Department, which had employed about 82,000 people and touches the lives of every American through its oversight of medical care, food, and drugs. The layoffs and reorganization will cut especially deep at two agencies within the department that have been in Kennedy's sights: the Food and Drug Administration and the Centers for Disease Control and Prevention, the CDC. Those agencies are expected to lose roughly 20% of their staff members from the latest cuts alone, and together with previous buyouts and early retirement spurred by Trump administration policies, the move will bring the department down to about 62,000 employees, the agency said. The restructuring is intended to bring communications and other functions directly under Kennedy, and it includes creating a new division called the Administration for Health America. "We're going to do more with less," Kennedy said, even as he acknowledged that would be a painful period for HHS. Kennedy said rates of chronic diseases rose under the Biden administration even as the government grew. He pitched the changes as a way to refocus on the Agency on America's Health, but did not outline any specifics on how he would reduce rates of diabetes, heart disease, or any other conditions. Inside the affected agencies, stunned employees struggled to absorb the news. Democrats and outside experts said the move would decimate agencies charged with protecting the health and safety of the American public, depriving them of the scientific expertise necessary to respond to current and future biological threats. In the middle of the worsening nationwide outbreak of bird flu and measles, not to mention a fentanyl epidemic, Trump is wrecking vital health agencies with the precision of a bull in a china shop, said Senator Patty Murray, a Washington Democrat who's been a leader on health issues in Congress. She called Kennedy's comments about doing more with less an absurd suggestion that defies common sense. Her sentiments were echoed by several agency employees who spoke on the condition of anonymity to avoid retribution. They said they worried not for themselves but for the country, expressing concern about what the layoffs would mean for public health and whether putting safety at risk was really what Americans want. Under the plan, the CDC, which handles a wide range of health issues including HIV/AIDS, tobacco control, maternal health, and the distribution of vaccines for children, would return to its core mission, quote-unquote, of infectious disease. Converting CDC to an agency solely focused on infectious disease takes us back to 1948, without realizing that in 2025, the leading causes of death are non-communicable disease. And Dr. Anand Parekh, who served in the health department during the Obama administration and is now the chief medical advisor at the Bipartisan Policy Center in Washington. The CDC will have its workforce cut by about 2,400 employees and will narrow its focus to preparing for and responding to epidemics and outbreaks, an HHS fact sheet said, but it will also absorb the Health Department's administration for strategic preparedness and response, which has 1,000 employees and was elevated to its own separate agency under the Biden administration during the coronavirus pandemic. The reorganization will cut 3,500 jobs from the FDA, which approves and oversees the safety of vast swaths of medications and food people eat and rely on for well-being, the fact sheet says. The cuts are said to be administrative, but some of the roles support research and monitoring the safety and purity of food and drugs, as well as travel plans for inspectors who investigate overseas food and drug facilities. The National Institutes of Health will lose 1,200 staff members, and the agency that administers Medicare and Medicaid is expected to lose 300. All of those agencies tend to operate under their own authority, and Kennedy has been at odds with all of them. Kennedy assailed them and other parts of the department in a YouTube video. "When I arrived, I found that over half of our employees do not even come to work," he said. HHS has more than 100 communication offices and more than 40 IT departments and dozens of procurement offices and 9 HR departments. In many cases, they don't even talk to each other. They're mainly operating in silos. The 28 divisions of the Health and Human Service Department will be consolidated into 15 new divisions, according to the statement issued by the department. Kennedy announced the changes in his video. The staff cuts reported earlier by the Wall Street Journal are being made in line with President Trump's order to carry out the Department of Government Efficiency's drive to shrink the federal workforce. The plan also includes collapsing 10 regional HHS offices into 5. The department notified union leaders of the reduction in force, known as the RIF in federal parlance, early Thursday morning by email, and the message obtained by New York Times said the layoffs would most likely take effect on May 27 and were primarily aimed at administrative positions including human resources, information technology, and procurement and finance. Democrats, including Ms. Murray, reacted with fury to the cuts. Representative Gerald Connolly of Virginia, top Democrat on the Oversight and Government Reform Committee, said the cuts were troubling amid a bird flu outbreak and the uptick in measles cases. Republicans seem to be taking more of a wait-and-see stance. Senator Bill Cassidy, Republican Louisiana, chairman of the committee that oversees health, said he had breakfast with Kennedy on Tuesday. Cassidy suggested he was open to the reorganization, but expected the two would have more conversations about specific cuts as their effects became clearer. Doreen Greenwald, president of the National Treasury Employees Union, which represents 18,500 HHS staff members across the country, issued a statement vowing to pursue every opportunity to fight back on behalf of these dedicated civil servants. This is a making of a man-made disaster, said someone on social media. Kennedy suggested in the video that changes would help his team get more access to data. That prospect has been worrisome to his critics, given Kennedy's long history of manipulating figures to advance arguments about what he contends are the risks of vaccines that have widely been deemed safe. In one case, Kennedy said, defiant bureaucrats impeded the Secretary's office from accessing the closely guarded databases that might reveal the dangers of certain drugs and medical interventions. Kennedy said the new division he's creating, the Administration for Health America, would combine a number of agencies focused on substance abuse treatment and chemical safety, as well as the agency that administers courts that handle federal claims over vaccine injuries. This is from New York Times on DNYUZ. Please leave your comments, and thank you for your support. Please support my Patreon account. The daily posts are 5 videos daily, and they are totally different from what I have on my YouTube channel. Thank you so much for your support and that you find all my content so interesting. You'll find the Patreon account details in the description box below.